So without further words, I mean, I think I again take great pleasure in inviting Dr. Salvi to speak on his subject, and hope that you'll be able to take questions from all of us. There's already several questions, and again, very, very warm welcome to you, Dr. Salvi. Thank you for making time for us.
Thank you very much, Dr. Jaya, for that very kind introduction. Thank you, Dr. Ramya, for organizing this wonderful webinar. And I must say that it's always a pleasure to be in front of journalists. I have had a fantastic experience last time when I was invited to Chennai to speak to the group of journalists on asthma and COPD, and was so happy with the sort of impact that it created on the journalist's mind, as well as the amount of publicity that they were able to carry out after that was very, very heartening. So thank you for giving me this opportunity. And I hope that today's program will also be a lot of learnings for all of us who are attending this meeting. There's so much of new knowledge available in this field. And what I'm going to do is share with you this very fascinating field of chronic respiratory diseases, and then switch over to the role of masks in my second presentation. Rashmika, you would need to allow me to share the screen. If you can give me that permission, please.
All right, sir. Please go on.
Yeah. Sorry. Screen. How do I go to the?
You can just go.
How do I go to my?
You can just go directly to your PowerPoint, sir.
Okay. Okay. Is that? Oh, I don't see.
Yeah, we can see.
Can you see my presentation?
Yes, yes, we can see.
Okay. Okay. Yeah. Can you see the full screen now?
Yes. Yes.
Can you see the screen? Okay.
Yes,
okay.
thank you.
So I bring to you greetings from my new foundation called as the Pulmocare Research and Education Foundation, which is situated in the city of Pune. As Dr. Jaya said, I was associated with the Chest Research Foundation, which I led for the last 18 years. And we had a very, very fruitful research outcome that came through the Chest Research Foundation. So if you all happen to come to Pune, do come and visit my foundation. It will be a pleasure to show you my foundation and share with you some of the exciting work that we are doing in the field of chronic respiratory diseases. Okay. The first thing that you do when you're born is you take a breath. It is called as the first breath. And the last thing that you do before you die, you take your last breath. Life is a period that is defined between the first breath and the last breath. Isn't this interesting? Because breath is equated to life. When the baby is growing in the mother's womb, it is not called life. Life starts only when the baby comes out of the womb and takes the first breath. So breath is life. And I think it's so very important for us to appreciate it, because we take breath for granted. And only when we give our last breath that we realize how important it was. Every minute, each one of us breathes about 15 times. So even you, as you're watching my presentation, you're taking a breath, one breath almost every 4 seconds. So that's about 15 times in a minute. And with each breath, you pull in about half a liter of air into your lungs. On a daily basis, all of us breathe about 10,000 liters of air. Why do we need to do that? Why is air so very important for us? It is because air comprises of oxygen, which is the life-giving force for all living creatures on this planet. Oxygen is absolutely necessary for survival. We can live without food for a few weeks. We can live without water for a few days, but we cannot live without air for more than a couple of minutes. Air is absolutely necessary for survival. And I really understood the importance of oxygen when I asked this question to a small cousin of mine. She was just 7 years old. And I asked her, Neha, what does a car run on? And quite obviously, I think she was quite prompt in giving the answer. Uncle, it runs on petrol or diesel, I mean, whichever fuel it uses. Really? Does a car run only on petrol or diesel? Or does it require anything else without which the car will just not be able to run at all? And this is where I realized that we do not appreciate the importance of oxygen for the combustion of petrol or diesel in the car, in the vehicle, or for that matter, any vehicle. The oxygen that is present in the air is absolutely necessary to burn the petrol or the diesel and to generate that into energy. So I was very inquisitive as to how much oxygen does a car require if it burns 1 liter of fuel. So I searched all the Google sites and did a lot of search everywhere, but I could not find an answer. So ultimately I had to go to the mechanical engineering books and understand how an engine works and then the air fuel ratio. And to cut the long story short, this is what it taught me, that to burn 1 liter of petrol, it requires 1,700 liters of oxygen. Now we know that the oxygen that is present in the air is around 21%. So 1,700 liters of oxygen means that the vehicle requires 8,500 liters of air for it to burn 1 liter of petrol. So the reason why I'm telling you this is petrol costs about 70 or 75 rupees a liter. We have value for it because we are paying money out of our pockets. But because air is freely available for us and so is oxygen, we take it for granted. We have no value for the air that the vehicle uses. And if I had to charge you a certain amount of money for the oxygen that is present in the air, I went onto the Amazon website and I asked a question, is oxygen cylinder available? And the answer was yes, oxygen is available for sale at the price of 30 rupees a liter. So if I have to burn 1 liter of petrol and I need 1,700 liters of oxygen, which costs 30 rupees a liter, you can only imagine what must be the cost of oxygen to burn that 1 liter of petrol over a distance of, say, it goes for about 10 or 12 or 15 kilometers. It costs about 50,000 rupees. Okay, to travel from point A to point B, burning 1 liter of petrol, the amount of oxygen that you would need to consume is worth rupees 50,000. As I said again, because we have no value for the air that we breathe, we take it for granted. It is only when that becomes a scarcity that we start appreciating the value for it. Now that is the importance of oxygen in driving a vehicle. What about the importance of oxygen for the human body? And here is something that really struck me very hard. Oxygen that you breathe through your lungs generates 90% of the body's energy. Only 10% of the energy comes from the food that you eat and the water that you drink. So that is how important is oxygen for the human body's survival and for the functioning of the various organs and the parts of the human body. So that's how important oxygen is for the human body. Now here is a tree that I just drew today morning, and I thought it looked nice, isn't it? It's a tree, a beautiful tree. What I'm going to do is I'm just going to remove all the leaves of this tree, and this is how the tree would look like. So this is what would it look like in the autumn season, isn't it? When the shedding of the leaves takes place. Now what I'm going to do is I'm going to invert the tree. But before I do that, we all know that a tree is the one that takes in carbon dioxide and gives out oxygen, isn't it? All the trees take in carbon dioxide and give out oxygen. Now I've just inverted this tree, and I can tell you that this is something that takes in oxygen and gives out carbon dioxide. Do you know what it is? Do you know what it looks like? This is the airway of the human lung, or the branching pattern of the tubes through which air goes in and out. It looks exactly like a tree. And that is what I wanted to showcase to you, that the tree and the lung, they are so similar. They're so similar. The only difference between the tree and the lung is an inverted shaped tree. And the branches that you see over here, they are the airways through which the windpipes through which air goes in and out. And the leaves that I had shown you, those are the alveoli from where oxygen enters into the blood and then carbon dioxide comes out. So that's the beauty of the tree and the lung. And you can see from this figure that the tree and the lung are made for each other. The trees take in carbon dioxide and give out oxygen, and the lungs take in oxygen and give out carbon dioxide. Perfect harmony in nature. And this is how the lung actually looks like. I hope you can see it on the screen now. Yes, this is how the lung actually looks like. So this is an inverted tree that I showed you before. You can see the main stem of the tree, and then the branches into the two lungs. And this is the branching pattern of the airways or the windpipes through which air goes in and out. And the main function of the lung is to extract oxygen that is present in the environment. And as I mentioned to you earlier, we breathe about 10,000 liters of air every day, and about 21% of that is oxygen. So about 2,100 liters of oxygen enters inside our lungs every day. Now, if you remove all the alveoli, which is like the shape of a circle, you remove all the alveoli. There are 600 million such alveoli in the lungs, and you spread them apart. They will occupy the size of a tennis court. That is about 100 square meters. That's how big surface area is available within the lung for the oxygen to enter into the blood and the carbon dioxide to come out. If you do not do any activity during the day and you just sleep for 24 hours, you just sleep, do nothing, your body would still need to burn 500 liters of oxygen every day. For all of us who are doing our routine day-to-day activities, like you are attending this webinar, I am giving a talk, everyone is moving around doing their daily routine, people then need to burn about 1,000 liters of oxygen during the routine day-to-day activities. And if you're an athlete and performs a lot of physical exercise, running, and so on, then your body needs to burn about 1,500 liters of oxygen every day. And I told you the cost of oxygen when I showed you the combustion of the car. So that's how oxygen is so important, and this is the organ in the body that nourishes our body with oxygen. Because oxygen is so important for us, which is present in the air, we breathe, as I said, about 10,000 liters of air. You need to breathe pure air. And I was surprised when I asked my son, who was in 9th standard a few years ago, I said, Anish, can you tell me what is pure air? And he said, Dad, pure air is pure air. So I said, no, what is the composition of the pure air? And he did not know what is the composition of pure air. Many of us do not even know what is pure air. What does it comprise of? And I've shown you over here, pure air comprises of these different components like nitrogen, oxygen, argon, carbon dioxide, and water vapor. The most important is obviously oxygen, which is around 21%. So if you have this composition, then this is pure air. However, very few people who live on this planet actually breathe pure air. They all breathe a lot of that is polluted by various air pollutants. So this is air pollutants, dust, bacteria, viruses, fungi, pollen. All this is present in the air. And what we breathe, what we humans breathe, is a mixture of all this. Sadly, India is one of the most polluted countries in the world. So 99% of Indians do not breathe pure air. Only 1% of Indians have been estimated to breathe pure air, and that's somewhere in northeast of India and some places on the mountainous areas in southern part of India. But by and large, 99% of people in India breathe impure air. And especially if you're living in Delhi, Uttar Pradesh, Maharashtra, Bihar, West Bengal, the air is so polluted that we are actually breathing more pollution than pure air along with that. And we know that air pollution is divided into two components. We have the gaseous pollutants, and then we have the particulate matter pollutants. Out of these two, the particulate matter pollutants are the most important ones because these are tiny, tiny, tiny particles that go into the deeper portions of the lung with every breath that you take in, and they have the potential to cause damage. So those particles which are less than 2.5 microns in diameter, they're called as PM 2.5. So they're very, very tiny particles which go, as I said, into the deeper portion of the lung and cause damage. The sources of air pollution, you have AAP, HAP, and occupational. AAP is not the Aam Aadmi Party. AAP is ambient air pollution. That is pollution that is present outside your house. HAP is household air pollution, pollution that is present inside your house. And IAP is indoor air pollution. So indoor air pollution is both inside your house, but if you're working in an office, if you're working in some other place indoors, then the pollution that is present inside that is also called as indoor air pollution. And then the third component is pollution that is generated at workplaces, which we call as occupational exposures. And this is a map of India that shows the levels of PM 2.5 across the country and with the heat map. And you can see that the red spots over here are all in the northern part of India, which is the most polluted part of India. And you can see this whole Indo-Gangetic plain is the one that very sadly bears the biggest brunt of air pollution in our country. And if you look at the number of cities in India who have very high levels of air pollution, it is extremely high. The various sources of ambient air pollution, so that is pollution outside your house, mainly comes from motor vehicles. It comes from the road dust. So road dust is a major source of air pollution. And in the city of Pune, it contributes to 60%, more than the pollution that is coming from the motor vehicles. It's the pollution that is coming from the road dust. So when a motor vehicle goes on that, the dust gets resuspended, and that causes more pollution than the exhaust coming from the motor vehicles. And then we have the industrial sources as over here. Crop burning, especially in the northern part of India, Punjab, Haryana, all that pollution comes to Delhi because of the wind. So crop burning is an important source of ambient air pollution. Burning of garbage in the cities and towns, this should not be allowed at all because this is very, very polluting both the environment as well as is very harmful for the lungs. And then this is dried leaves that many people burn soon after the summer season. Household air pollution or indoor air pollution. About 60% of homes in India still use biomass fuel for cooking. So they burn wood, they burn gobar, they burn dried leaves, crop residues. And the smoke that comes out of this, as you can see here, is the one that is responsible for causing air pollution. Biomass is a major source of air pollution. This is something that I have spoken in my previous talk. The pollution that comes from the burning of one mosquito coil is as much as smoking 100 cigarettes. So household air pollution, one of the major sources in most 60% of the homes in India is a mosquito coil. If you are surprised and shocked because of this, then the dhoop stick, which is only 4 centimeters, it burns only for 15 minutes. But the amount of pollution that one dhoop stick produces is equal to smoking 500 cigarettes. One mosquito coil is 100 cigarettes. One dhoop stick is 500 cigarettes. That is how polluting the dhoop agarbatti is. And this is something that should be banned completely. Even the agarbatti sticks that people use for pujas, they also produce a lot of household air pollution. And you can see here the different types of incense that is burned. Then we have the samrani smoke in South India. We have the dhunachi smoke in West Bengal. We have the traditional aarti. And all these are major producers of indoor air pollution. So when you visit the temple, you go to the temple to get blessings from the god. But in return, you actually come back having inhaled a lot of pollutants that were present in the smoke from the temple. And that has been shown to have harmful effects. These are the occupational sources of air pollution. You have, so this is the Dhanbad mine. Somebody asked me a question yesterday on coal mining, the amount of dust and the smoke that you're exposed to. But even farming is an important occupation associated with air pollution and therefore causing chronic lung diseases, use of pesticide sprays, building and construction, especially in big cities and towns where a lot of buildings are being constructed. The dust that comes out of that is also a major source of air pollution, particularly occupational exposures. The road sweeping in the morning, the women who smoke, who sweep the roads, they're also exposed to a lot of pollution. Temple pujaris are the ones who are also exposed to a lot of air pollution. So this is an occupational hazard to be a temple pujari. And then if you have sand blasting, there is a lot of dust and smoke that is produced. So there are a lot of other occupations where the lungs are exposed to a lot of air pollutants that cause damage. This is how the healthy lung looks like. It is light pink in color. And this is how a lung looks like that is exposed to air pollution. You can see that the lung becomes black in color, it becomes big in size because there's a lot of air trapping that occurs inside the lungs. And you can see this small thing over here. This is the heart, which is situated between the two lungs. And you can see that when you have a lung that is affected because of air pollution, the heart becomes big in size. And these people are not only vulnerable to develop chronic lung diseases, but they also develop heart disease because of exposure to air pollution. So air pollution could be from tobacco smoking and all the other causes that I mentioned to you today. I was part of the Global Burden of Disease report that for the first time actually developed the burden of chronic respiratory diseases in our country. And I'm going to tell you only the two of them, COPD or chronic obstructive pulmonary disease and asthma. Many of you all who do not know the word COPD, this is the second leading cause of death in India, and it is the second leading cause of suffering. Yet, people have not even heard this name before. So in India, there are about 55.3 million people who suffer with COPD. And when you compare that with asthma, it is around 38 million people who suffer with asthma. What is interesting is India contributes to 11% of the global asthma burden. So out of the whole world, out of 100 asthmatics, 11 are from India, which is okay. That is understandable because we have a very big population. But what is not understandable and acceptable is the second part of the statement. 43.4% of all global asthma deaths occur in India. So out of all the 100 asthma deaths that occur in the world, 43 come from India. And that's a very, very sad and a sorry statement that I have to make. But that is the contribution of chronic lung disease, especially asthma, from India. If you look at COPD, 22% of all the global COPD burden is from India, and 1/3 of all global COPD deaths occur from India. So asthma and COPD are the two main chronic respiratory diseases that affect our Indian population. Now, what is the impact of COVID on asthma and COPD? If you suffer with COPD, which is a chronic lung damage because of tobacco smoking or exposure to air pollution, are you more vulnerable to develop the COVID-19 disease? Not necessarily. Everybody is equally susceptible to catch the corona infection or the COVID-19 disease. But the difference is when patients of COPD catch the corona infection, they get a severe form of COVID-19. Whereas a healthy person who catches the COVID-19 infection, that person may have very mild symptoms or even no symptoms at all, and that person will recover over a period of time. But a patient of COPD, when he catches the COVID-19 infection, he will have bad COVID-19 disease, and he's more likely to die because of the COVID-19, because his lungs are already damaged because of the underlying COPD. We always believe that asthmatic patients are also more vulnerable or susceptible to develop viral infections. But all the studies that I have gone through in the recent past, asthma seems to be behaving very strange over here. So coronavirus affects everybody, but asthmatics seem to be less affected because of the coronavirus. But COPD is certainly more affected. So the people who are more affected are those who have COPD, those who have hypertension, those who have diabetes, and those who have heart disease. So these are the comorbid conditions that have been shown to make the corona more severe in these patients. The last few slides that I wanted to share with you is there any correlation or association between air pollution and COVID-19? And this is one of the first studies reported from China. And this is the map of China, as you can see here. The circles in red over here represent the number of cases of corona in the different parts of China. And then they looked at the air pollution levels present in all the regions of China. And what they found was very interesting, that in areas where the air pollution levels were higher, there were more people who were getting infected with coronavirus infection, more people. And also, when they caught the coronavirus infection, the disease was more severe in those people who are exposed to high levels of air pollution. So this was the report that came from China. This is from Italy. So this is not COPD, but this is COVID-19 disease. This is the number of COVID-19 cases in Italy. And you can see that in the northern part of Italy, they have the biggest number of COVID-19 cases. And when you compare that with the air pollution map of Italy, so this is PM2.5, this is the heat map for PM2.5. You can see this is exactly the same area where the pollution levels are high. So the Italians are now convinced that wherever the pollution levels are high, you will find more cases of COVID-19 in that part of the country. And then they were able to show a very nice correlation, as you can see over here, between the number of COVID-19 cases as compared to the levels of air pollution in those cities. And then this is from the United States, 3,000 US counties. They compared the total number of COVID-19 cases with the average air pollution levels over the last 17 years. So this is the air pollution levels over the last 17 years. And this is the COVID-19 cases in US. And you can see that they almost mirror image each other. Again, suggesting that places where the air pollution levels are high, COVID-19 cases become more in number. There are various mechanisms by which this has been suggested. So in air pollution, if you live in an area with high levels of air pollution, your lungs are already damaged, or your respiratory tract is already red and inflamed. And when a coronavirus comes inside that, it can enjoy, because it's got so much of nutrients that it can use for its growth and reproduction. So in an already damaged lung, the virus grows bigger in size. So that's one of the reasons why corona infections are more in places of air pollution. And second, it has been suggested that these PM2.5 particles, which are very tiny particles that we breathe into the lungs, the virus actually uses the PM2.5 particle as a mediator or a messenger to go inside the lungs. Because on its own, it's a very small virus. It normally gets transmitted through aerosol droplets. These are bubbles of sacs of water that come out when you're coughing or sneezing. So these viruses, then they can sit onto a particulate matter pollutant, and through that it can enter into the respiratory tract to cause a viral infection. Just the last slide over here, just to share with you, during the COVID-19 pandemic, there was a lockdown in most countries or many countries across the world. And China experienced the air pollution levels coming down by around 40 to 50%. And that's a lot of reduction in the air pollution because there were no vehicles on the road, no industries that were working. So the air pollution levels came down. After the lockdown, just read this headline. China's air pollution is now worse than the pre-coronavirus levels. So I think that is the unfortunate situation that occurs. So the lockdown creates clean air, but that is always followed by a sudden increase in the levels of air pollution because everybody now wants to start making money. 2 months, 3 months, you stayed at home. You have not got a salary. Many people have not got a salary. So they want to keep on working 3 times more than what they were working before. And that then causes worsening of the air pollution after the lockdown is lifted. And it is now believed that there are more cases of COVID-19 that are occurring in China because of the air pollution levels. So I think it's something that we must be aware about. Now I'm going to stop over here and I'm going to take questions from the audience based on the first part of my presentation. So Dr. Jay, how do you go about doing this?
I'll be fielding the questions, Dr. Salvi. First, we will try to answer the questions which we have already received from our journalists, Mr.
Yes.
Mohan Kumar Gop and Mr. Satananda. They had Mr. Satananda, who's a freelancer, and Mr. Mohan from Dhanbad. He says, what is the impact of pollution in coalfield areas like Dhanbad in Jharkhand, and what precautions are to be taken in areas full of dust?
Okay, so Dhanbad had 2 major issues. One is when you're digging the coal, there's a lot of smoke that is present. So the people who are working in the coal mines, they are exposed to a lot of pollution. That is one. Second is when the coal is being transported to the power stations, and at the power stations it is being burnt to generate electricity. The smoke that comes out from the power stations, that is the one that spreads all across the the area, many hundreds of kilometers across, and then it affects a wider number of people living in that area. So there are 2 issues with coal mining. If you're a person who is working in the coal mining, digging out coal, you have to protect yourself by wearing special kind of masks. And I'll cover that in my subsequent presentation. But wearing a mask is absolutely crucial to save your lungs from being affected with a very high level of dust that is present. Now, what about the people living in the surrounding area? They're also exposed to coal smoke. Sadly, I think there's very little that you can do about it because the pollution levels are so high that even wearing a mask can give you some protection. But the only way to reduce that or mitigate that is to make sure that there are not many people living around the coal mining area, not many people living around the places where the coal is burnt. Otherwise, it's going to have a very significant harmful effect. So we know what has happened to Chandrapur. We know what has happened to Dhanbad. These are major issues that the government needs to start doing something about, because otherwise we're going to pay a very heavy price for the poor health that we're going to create in thousands of people who are exposed to these pollutants in that area. Yeah.
Thank you so much. We have another question in our chat box. Any precautions to be taken by asthma patients while going out during COVID-19 crisis?
Everybody who goes out of the house during this current pandemic must go with a mask, must go with a good quality mask. And what is a good quality mask? I'm going to show that in my second presentation. But wearing a mask, hand hygiene, cleaning a hand all the time, keeping a safe distance is what everybody should do, not only the asthmatics. But the special thing that asthmatics must do is that during this period, they must take their inhalers on a regular basis. The reason for that is, if your asthma is well under control, then the chances of you developing a severe form of COVID-19 becomes less. If you have poorly controlled asthma and now you got a corona infection, then you get this severe form of COVID-19 disease. So take your medications on a regular basis. All asthmatics must take the inhalers regularly so that their asthma becomes well under control, and then they do not get converted into the severe COVID disease in case they catch it.
Okay, Dr. Salvi. There is another question from Geetika from Bangalore. She is with the News Minute. So you said that people with asthma seem to be less affected by COVID-19. Did you mean that people with asthma are less likely to be affected by SARS-CoV-2, or that people with asthma, when affected, don't get severe form of COVID-19?
So I'll tell you what has been done so far is if you take the flu virus, if you take the other viruses that affect the respiratory tract, and if you take a group of healthy people and a group of asthmatics, the asthmatics will always catch more viral infections, and they will the viral infection will remain for a long period of time. This has been known. I mean, this knowledge is already existing, and we were hoping that the same observation would also be made for the SARS-CoV-2 virus, which is the COVID-19 virus. But sadly, that has not been the case. So if you take a group of healthy people and take a group of asthmatic people, they seem to have the same risk of catching the COVID-19 infection. Then both of them have the same risk. Unlike the other virus infections, which asthmatics are more vulnerable to. Now, why is that the case? Nobody really knows the answer, but people are trying to find that answer out. Yeah.
We have a question. How long do we have to follow social distancing? And healthy lungs can also get affected with COVID, which can lead to death.
No, so if you have healthy lungs, then despite you catching the coronavirus infection, the virus only manifests with very mild form of a disease, and then you recover. About more than 95% of the people who have healthy lungs will recover very fast, and that has been shown from all these other countries. Now, who are the people who are vulnerable to the coronavirus infection, who are vulnerable to die because of the coronavirus infection? The elderly people who are more than 65 years of age. Second is those people who have associated heart disease, hypertension, diabetes. If they have underlying diseases, then the corona makes the disease more chronic, and also COPD. So these are the susceptible or the vulnerable groups. But by and large, I think majority of the people who catch the viral infection, about 80% of them do not even manifest with any serious symptoms. They just have a mild weakness, a little bit of cough. They don't even realize that this was a coronavirus infection that they had. But that's about 80% of the people. The remaining 20% will manifest with some form of symptoms.
Right, doctor. We have time for one last question about risk factors asked by Ms. Shabitri Dhakal from Nepal. So she asks, what are the risk factors for COVID-19 for people who are already suffering from chronic respiratory health problems?
The same thing that I mentioned now. So if you have an underlying problem, then you are more vulnerable to catch the severe form of the disease. See, infection is the same for everybody, whether you are a child, whether you are an adult, or whether you have other comorbid conditions. Chances of spreading the infection is the same. But once the virus goes inside, then if you have the underlying other conditions that I mentioned, then the coronavirus disease becomes more severe. And so those are the risk factors that are associated with greater severity of the COVID-19.
Okay, doctor, thank you so much. The rest of the questions that have been asked in the chat box are related to the second part of the presentation. So we're requesting Dr. Salvi to answer them in the next question answer session.
Sure. Okay. So let's go to the next part of the presentation, which I believe is a very important presentation. And I'm sure all of you will get to learn a lot of new things from this presentation. Just a starter for COVID-19. The COVID stands for coronavirus, which is the 7th coronavirus that we are exposed to so far. VI stands for virus. We know that is a new coronavirus. D is for disease, and 19 is the year in which the first infection occurred. So a coronavirus disease that started in the year 2019. Globally, we have, as of today, we have 5.4 million people who are already infected globally, 345,000 deaths. And in India, so far, we have had 138,000 people who are infected and more than 4,000 people who have died so far from coronavirus. Now, what I'm going to share with you is this part of the story. Even a simple thing like a mask has a story to tell and teach and the potential to save millions of lives. This is going to be the theme of my presentation, where I'm going to cover historically how the masks originated and what is the impact of the use of masks in the current COVID-19 pandemic. This is a very interesting photograph, 1903, in the United States, in Chicago, one of the big medical colleges. This is the surgery operation theater, and this is the amphitheater where the postgraduate medical students who are doctors, they sit here and they listen, they see the surgeon operate. Here is the chief surgeon, this is the assistant surgeon, and you can see the nurse over here who they're all assisting this surgeon who is operating upon this patient. 1903, I want you to see something very unusual in this photograph. One is everybody is sitting in a place which is open, so the operation theater was an open-ended one. You can see that the surgeon is wearing a cap, but there is no mask. Nobody is wearing a mask over here, and nobody is wearing gloves. So in 1903, when the surgeons were operating, they used to only clean their hands with soap and water. They used to not wear any gloves, and they used to operate with their bare hands. They never had a mask. And the story of how the mask evolved or originated in the surgeon is very interesting. I'm sure all of you have gone to cinema theaters. And when you sit on the chair and you're looking at the screen, the ray of light that is bringing the image from behind on the screen, if you look at it, you will find that there are a lot of these tiny particles which fall on the ray of light that hit the screen. And I'm sure all of you will have seen this. So there was one of these doctors, a very clever postgraduate doctor who was sitting in the amphitheater, and he made this very interesting statement to the teacher the next day. So the teacher was, I'll tell you who the teacher was in the next slide, but I was told by a student in a large medical college that he had often noticed during surgery that there was a certain, that when he was seated in a certain direction, he could see from the amphitheater a continuous spray of saliva from the surgeon's mouth falling onto the patient. And the question that he obviously asked was, shouldn't protection of the mouth of the surgeons and the nurses be necessary to prevent that spray of saliva, the sputum, falling onto the patient's operation area? Shouldn't there be something that should be protecting the surgeon? Very interesting observation made by a medical student while sitting in the amphitheater watching the surgeon operate. The teacher who was who this medical college student approached was Dr. Alice Hamilton, a very reputed surgeon and a teacher in the Chicago Medical College. She later went on to become the first woman professor of the Harvard University. And she was very, very intrigued by what the student told her. And then she said, I'm going to do experiments to find out, really, is there a problem? So she took this culture plate, on which you can actually grow bacteria. And then she called the surgeon and she said, I want you to act as if you are operating on a patient. But she did not keep the patient on the operation table. She kept a mannequin. And on the top of the mannequin, she kept this culture media on which bacteria could be grown. And then she told the surgeon, you do exactly what you do when you're operating on the patient and when you're teaching the students. So that the surgeon then started teaching the students, or he started talking. And even she could also see that when the surgeon was talking, there was a spray of saliva coming from the surgeon's mouth that was falling onto the culture plate. And then when she took the culture plate and to the microbiology lab, she was able to identify a lot of bacteria that the surgeon was transmitting from his mouth. And very, very interesting observation she made. She also went on to find out, if you take an antiseptic mouthwash, does that reduce the amount of bacteria coming from the surgeon's mouth? And the answer was no, it doesn't have any impact. Then she was able to find out that talking, coughing, and sneezing, 3 activities that release a lot of these bacteria from the person's mouth or from the nose if you're sneezing. Surprisingly, you release as many bacteria as you're talking, and as much as when you're releasing the bacteria when you're coughing. See, all these days we were led to believe that if a person is coughing, he's transmitting the virus from outside into the air. But why coughing? Even talking, for that matter, also releases a lot of these bacteria into the air. And she was able to show that whispering produces more droplets than talking. Very, very interesting. And then she went on to make the statement that the mouth of the operating surgeon is a fruitful source of bacteria infection, even after usual precautions of disinfection. And she is the first person who recommended all surgeons should wear a mask. Why? Not to protect the surgeon, but to protect the patient who is being operated. And I tell you, the story was very interesting later on, because when she made that statement, she was in Chicago, and then only a few surgeons around Chicago actually listened to her. And then in 1927, many years later, there was a very unusual episode that happened in one of the big medical hospitals in New York, the Presbyterian Hospital in New York. A series of bad bacterial infections occurring on the post-operative wound of patients. So many patients who underwent operation, the place where the incision was taken and then you put the sutures, lot of infection occurring at the suture site or at the place where the incision was made, and the hospital was really worried. This is the so many number of patients having post-operative wound complications. And then based on the story that Alice Hamilton had mentioned earlier, they thought maybe the doctors are responsible. The surgeons are the ones who are causing this infection. So what they did was they went to all the surgeons and they took throat swabs. They took the throat swabs from all the surgeons' mouths and from the nurses also. And this is what they found. 33% of the surgeons and nurses were actually carrying the bacteria inside their mouth. They had no symptoms, no fever, no cough, nothing, but they had bacteria inside their mouth, which they were transmitting to the patient. And the wound was therefore getting infected. The surgical site was getting infected with this bacteria. And that was the reason for why the complications were occurring. So it was this episode from New York. After this, the whole world started using a mask. All the surgeons started wearing a mask. The nurses started wearing a mask, not to protect themselves, but to protect the patient on whom they were operating. So that's how it's a very interesting story of how the first masks evolved from protecting the patient to protecting protecting the patient. Then came the second part of the story, very interesting, 1910 to 1911, the Great Manchurian Plague of 1910. Manchurian is a place in China where they had this big pneumonic plague, and where about 50,000, 60,000 of these people died. And this plague was not transmitted by the rats, it was transmitted by airborne droplets from one person to the other because of coughing and sneezing and talking. So there was this young Malaysian-born doctor who was working in Manchuria at that point of time. He was educated in the UK, where he probably got exposed to the surgeons wearing a mask, and he said, "Why don't I wear a mask to protect myself from catching the pneumonic plague?" So he started wearing the mask over here, as you can see here, a simple surgical gauze on which a bandage was put. And then he called this as the plague mask. And he said that this is the one that is going to prevent me from catching the infection. Stories tells us that there's one English doctor, a British doctor, who came to visit the Manchurian plague at that time. And when he came and met this doctor, he said, "You look so funny with this mask. You look like a thief to me. Why are you wearing this?" He said, "I'm wearing this to protect myself from the pneumonic plague." He said, "Are you crazy? How can this protect you from the pneumonic plague?" And then the story goes further to say that the British doctor actually caught the pneumonic plague infection and he died because of that. And since then, people started understanding the importance of protecting themselves by wearing a mask. And so he was the first person who suggested for the first time, 1910, 1911, that all doctors, nurses, paramedics, those who are associated with the patient's transport and all that, everybody should wear a mask because this is going to protect you from catching the infection. First time in the history, a mask was worn to protect yourself from catching another infection. 1918, there were two very big papers that were published that showed for the first time that you can prevent diphtheria, meningitis, and pneumonia by wearing a mask. So there were two big studies that seemed to show conclusive evidence that this is a protective thing for preventing you from catching the infection. And then another paper in 1918 where, so the gauze, you can see the gauze cotton, the gauze cloth over here. This is a coarse gauze. You can see that there are very few threads in that gauze. So somebody went on to do the experiment to find out what is the efficacy or the efficiency of this coarse gauze to protect yourself from the bacteria. So what he did was, he took this culture plate and kept them at a distance of 1 feet, 2 feet, 3 feet, 4 feet, 5 feet, 6 feet. Okay? So one was kept here, one was kept here, one was kept here, like that. And then on the y-axis, you can see here, there were 2 layers of the coarse gauze. There were 3 layers, 4 layers, 5 layers, 6 layers, 7 layers, and so on. And then a person who was suffering with an infection was asked to cough for 5 minutes. And you can see here that if you had the lesser number of gauze pieces, and if you're closer to the source of infection, there were more bacteria that were captured on the culture plate. If you went further away, the number of bacteria reduced, and if you put in more layers of mask, the number of bacteria reduced. So very interesting observation. Then after the coarse gauze, they went to the medium-sized gauze. So now you can see there are more threads in that gauze. And you can see now that the number of bacteria, they were much lesser, both in terms of the distance of the culture plate as well as the number of layers of the medium gauze compared to the coarse gauze. And if you look at the butter cloth, very fine threads. And now you look at the efficacy of the butter cloth, and that was able to protect or filter off all the bacteria that were passing through. So this is the first time we realized that not all the material that we use is the same in terms of protecting you from catching the infection. The coarse gauze is good, but it allows many bacteria. The medium coarse is better, and the butter cloth is the so-called the best out of the lot. The Spanish flu of 1918 was perhaps the second biggest pandemic that occurred in the world. 500 million people were infected, and it caused about 50 million deaths. The same virus, H1N1 influenza virus, which likely originated from China, but the affliction was predominantly seen in Europe and in the United States. So 1918 was the time when the World War I had just got over. The soldiers were returning back to their homes. 40 million people had died in the World War I. And the countries were feeling it very, very sad to tell their families that many people died in the war. And therefore, they hid the number of patients who were now dying because of the flu pandemic. So the soldiers were coming back to their homes. They were dying on the road during the journey while coming home because of the influenza pandemic. And Spain was the World War I neutral country, so it didn't take part in any of the World War. So they had no deaths of their soldiers, and therefore they were the only ones who were reporting that there are a lot of patients of flu suffering in our country. So many people are suffering, so many people are dying, and therefore the misnomer that it was called as the Spanish flu. Mainly the young people died largely because of the poverty caused by the World War I. And there's some people say that there was excess deaths because of overuse of some of the medicines like aspirin during that pandemic. So the reason why I'm telling you about the Spanish flu is something unique happened in the San Francisco County in the United States, where the mayor actually put forward an ordinance, 1918. Everybody has to wear a mask, compulsory, to protect yourself from the influenza virus infection. If you do not wear a mask, you will be fined anywhere between $5 to $100 or 10 days of imprisonment or both. Look at how strictly it was enforced in the city of San Francisco in California. Everybody was asked to wear a mask. And on the very next day, this is October 24th, 1918, 100 people were caught by the policemen for not wearing a mask, and they were fined or they were jailed. The Red Cross was a very popular organization at that point of time. And in one of the famous newspapers called as the San Francisco Chronicle, as you can see here, there was an advertisement that was put by the Red Cross: wear a mask and save your life. The mask, a gauze mask, is 99% proof against influenza. 1918, this was the advertisement. Wear masks, and each mask was sold for 5 cents. To cut the long story short, a lot of people bought the masks, everybody started wearing them. And at the end of the pandemic, it was only the San Francisco County that had the least number of deaths because of the influenza or the flu pandemic. That was the only county that had the lowest number of infections and the lowest number of deaths. Why? Because a lot of people were forced to wear a mask. You can see the Red Cross people over here. Everybody's wearing a mask. This is a nurse who was treating a patient with flu. Even she's wearing a mask. These were the policemen who were ensuring that everybody was wearing a mask. So they were also wearing a mask. Rich people were wearing a mask. And you can see that, the olden days we used to have that spray for the mask. So this person is spraying some chemical with the hope that the influenza virus will get killed. But we all know how effective that is anyways. So these were very common at that time: lockdown, social distancing, compulsorily wearing masks, and so on. And as I said, it was San Francisco that seemed to show the best response. Another very interesting story: 1918 to 1919, there was this big ship cruiser that was traveling. The World War had just, this was right in the middle of the Spanish flu pandemic, and all the people who were traveling by ship, on the ship, when they reached Southampton, many of them actually got infected with the influenza virus. So about, say, a couple of hundred people at least who were traveling to UK, to Southampton, got infected. None of them were wearing a mask. During the return journey back from Southampton to New York, the captain of the ship had heard about the success story of San Francisco, where the number of deaths were reduced because of wearing of a mask. So what he did was he ordered everybody on their way journey back from UK to US, everybody must compulsorily wear a mask journey. And very interestingly, not a single person caught the virus back during the return journey, probably only because all of them wore a mask. Then, so from apart from protecting yourself viral infections, bacterial infections, the masks started being worn to protect themselves from pollution. So this is the famous Donora smog in the United States in 1948, the London smog. You can see that everybody is wearing a mask to protect themselves from air pollution now this time. This is in our own, this is from Singapore, and this is in our own town city of Delhi during the pollution episode a couple of years ago. So now people have started wearing a mask to protect them from air pollution. One of the common masks used is a surgical mask, and a surgical mask is the one that looks like this. What I'm showing you, that's a surgical mask. You go to the shop. This is a mask that I got from the surgical shop. I said I want a surgical mask, and he gave me this mask. A real surgical mask must be made up of 3 layers over here. It should have 3 layers minimum, 3 layers. The type of material that is used in the 3 layers is a non-woven fabric. Okay, it is important to understand the difference between a woven fabric and a non-woven fabric. You can see that the non-woven fabric is a much bigger layer of fibers, and they have better filtering capacity than the woven fabric. And therefore, this is what is widely used. The non-woven fabric is what is widely used in the manufacture of many of these masks. So this mask has got this is what you attach to the ear. Then there are pleats over here. So these pleats, so that you can cover them right from the chin to the nose. Everything can be covered. It gives you a bigger surface area. The inner layer of the mask is made up of absorbent cotton-like material, and the outer layer is made up of the non-woven fabric. The point I wanted to make was all masks that look like this are not surgical masks. They're called surgical masks, but they're not. They're all fake surgical masks. So how do you know what is a good quality surgical mask? So what you do is if you fold your mask like this and put in half a glass of water inside this cup over here, if it is a correct mask, if it is an authentic mask, it will not allow the water to pass through. It will hold that water in that mask. So I did that. I put a half a glass of water into this, and within no time, all the water came out from the other end. So this is not a good quality surgical mask. I think it's important for everybody to know that, because you are fooled by the shopkeepers that you're actually wearing a surgical mask. The second type of mask, which is very important during the corona pandemic, is a respirator mask. And what is a respirator mask? A respirator mask is the one that was primarily designed to protect yourself from inhaling all these pollutant substances. So if you're working in occupations where there's a lot of dust, then you wear a mask, and which was very tightly fitting, was called as a respirator mask. A surgical mask was primarily designed so that other person doesn't get infected, whereas a respirator mask was primarily designed to protect your own self from inhaling all these harmful substances. Now, these masks that were respiratory masks, they're regulated by the National Institute of Occupational Safety and Health, called NIOSH in the United States. Now, just like how we have the films certified as A, U, or PG. A stands for adults, or U stands for universal, and PG stands for parental guidance. So somebody certifies, there is a certificate that decides who is the audience who should watch, who is entitled to watch this film. So they give a certificate of adults, universal or parental guidance. Similarly, the masks are also certified by a certifying agency to say who are the people who can wear this. And this is based on the NIOSH, National Institute of Occupational Safety and Health. And they have categorized the masks, the respirator masks, into 3 varieties: the N series, the R series, and the P series. Okay, very important. This is where the N95 comes from. The N series is the one that is not resistant to oil. And the reason why I'm telling you that is oily particles, which are very important in certain occupations. They're the ones that are the most notorious ones. They're the ones that can pass through in some of the most good filters. So to protect yourself from the oily filters, the best mask is the P mask. So P stands for oil proof. It does not allow any oily particles to pass through. R stands for it is resistant to the oily particles, but it is not oil proof. So it allows certain amount of protection against oily particles. And the N series are the ones that offer no protection against the oily particles. So I hope you have understood what is N series, R series, and P series. N, nothing to do with oil. It doesn't oily. It allows the oily particles to pass through. It does not offer any resistance for that. In each of these categories, you have the 95, 100, and the 95, 99, and the 100 series. So you have N95, N99, N100. You have R95, R99, R100, and then you have the thing for P as well. Now N95, what does N95 mean? It particular mask, it protects at least, it prevents at least 95% of the particles which are at least 0.3 microns in diameter to pass through. So the filtering capacity or the efficacy is more than 95%, and therefore it is called an N95 mask. N99 mask means 99% of the particles are not allowed to pass through. And N100 means 100% of the particles will be prevented from passing through. Now, obviously, you would want to choose N100, isn't it? The only problem with N99 and N100 is when you start wearing them, it is very difficult to breathe. You cannot breathe very easily through that at all. You feel suffocated. You feel a choky sensation when you wear that mask. And therefore, the mask that is relatively better, is the N95 mask, and it offers you 95% protection, which is good enough. And therefore, for all practical purposes, for the COVID-19 pandemic, we only talk about N95 and we do not talk about any of the other masks. I hope you have understood what is N95 mask. So N95 masks in 3 forms, and this is a molded, non-foldable. If you try to fold it, it breaks. So you should not fold it. There is no valve, as you can see. This is a molded, non-foldable with the valve. This is a foldable one, N95 mask, which does not have a valve. Now, if I ask you, choose whichever one you like for your use. And all of them are the same price, so you can choose whichever one you like. Which one are you likely to choose? The first one, the second one, or the third one? I'm sure all of you would like to choose the one in the middle, because it has got the valve. It looks a little more sophisticated, looks a little more, looks better because of the looks. The sad thing is, this variety of a N95 mask should not be worn in the COVID-19 pandemic. The reason why I'm saying this is I see a lot of people wearing the N95 mask with a valve. It should not be allowed. The reason for that is because of the valve, air passes out very easily when you're talking, when you're breathing. So if you're a person who is infected with coronavirus, you will easily transmit the virus through the valve. and therefore a valve is not recommended to be used in N95 masks for the community setting. You can use that in the hospital setting by the doctors and by the nurses. The reason is doctors and the nurses, when they wear it very tightly, they find it difficult to breathe. They have to keep on breathing using the same mask for 4 hours and 6 hours. And therefore, to make the breathing better, a valve is included in that N95 mask. But this valve is not meant for the people living in the community. So please, I think this is one message that must go out into the community, that a valve N95 mask should not be used. Again, it has got 3 layers, N95 mask, and again, it's got those fibers, non-woven fabric materials, and they have the ability to filter out very, very small particles. Now, there are 2 very important things with an N95 mask. It has to be worn very tightly. No leakage from here at all. You know, when you wear the surgical mask, I'll show you, when you wear the surgical mask here, there's a lot of air from going from here, leakage from here and leakage from here. So to avoid that leakage, there's a clip over here, as you can see in the picture over here. So you clip that and you reduce that space, because it has to be airtight. Nothing should be able to enter inside the mask from this side. Then only the mask works, otherwise it doesn't work. Now, therefore, a tight fitting mask is very, very important if you're wearing an N95 mask. And obviously it comes with its own problems. Because you have to wear it so tight, look at the amount of skin abrasions that this nurse has had. You know, it's not easy. If you have to wear it so tightly, because you don't want anything to leak outside, your skin is, damaged over here. At the same time, it's not easy to breathe through an N95 mask. N99, N90, N100 is more difficult to breathe, but even N95 mask is not easy to breathe. You try the N95 mask and you will realize that you have to make an effort to breathe. It is not come there. It's I may just go away on my I'll not show this slide. There are a lot of fake N95 masks circulating around. Are you seeing the not getting the slide? Okay, I think it is coming now. So there are a lot of fake N95 masks in the market. Let me tell you that. It's very important for all of us to know. And here is a news from China on the 26th of April this year. China has confiscated more than 89 million masks. A government official said on Sunday, 89 million poor quality masks were confiscated in China. You go to the shop, out of 10 times likely to that important, because we need to get a fake mask. It's important. Now, why is it know that fake masks are not as efficient as the genuine masks? So it's important how justify how a genuine mask like. A genuine mask look like, and as you get a lot of printed material on that. Genuine this mask. And this is really what scares me. You know, there's accused on the 31st of March. More than 12,000 fake N95 masks were seized from Bangalore. They were made of fabric that was used in the manufacture of vest and collar canvas. So poor quality, and they just put a label on that as N95. The company had already sold 70,000 fake masks for more than 1 crore rupees, and they were lobbying with the government of Karnataka to sell 10,000 N95 masks so that the doctors who are working in the government hospitals would get this fake N95 mask. And that would have been a very sorry state of affairs if the doctors and the nurses were actually wearing fake poor quality N95 masks. Many times I see people wearing this mask, and I think the screen has not changed. But this is called as a single layer face mask, and it is not made up of 3 layers, as I told you very clearly. very classically, a surgical mask is made up of 3 layers. So this is to be used only in the food industry to protect themselves, to prevent any bacteria falling into the food tray. So this is not recommended for the COVID-19 pandemic. I see a lot of people wearing this mask, so please make sure that this is not worn. The second variety of mask I believe should not be worn during the COVID-19 pandemic is the dust mask or the nuisance mask. It is just made up of paper, a paper mold, and it's a single strap behind. I see some of the journalists using it under television. I see some of the people wearing it on the television, and this is a mask that does not protect you at all from the COVID-19 viruses. It is only for very large particles, so dusty environments is where it should be used, but offers no protection against the coronavirus. So this kind of a not be so even so in this COVID-19 pandemic, is it necessary to wear a mask? Who should wear a mask? And Brooks wanted to take you through maybe a last slides over here. This is a slide that actually tells us what is the efficacy of different interventions during a pandemic like this. So frequent hand washing. If you wash your hands very frequently, more than 10 times a day, then the protection that this offers is around 55%. If you wear a mask and you wear it properly, you wear it continually, then the protection that it offers is around 70%. And if you wear a mask and wash your hands and have good social distancing and all that, the maximum protection that you can get is around 95%. So I think the slides have not yet changed, but I hope. So another very interesting story. This is from Wuhan, where after the pandemic, a middle-aged gentleman wanted to go to his village, traveled from point A to point in the bus. He did not know that he was suffering from coronavirus infection and his symptoms as well. But during that journey from point A to point B, 5 people got infected because of him. 5 people got infected. Now, from point B to point C, he had to change the bus to go to his village. And at that point of time, he boarded a minibus. But before he boarded the minibus, he found that there was a mask available in the bus station. He wore a mask. He thought, I will protect myself from wearing a mask. And because he wore a mask, not a single person got infected in that journey from point B to point C. Now, this is just like the story of the mask. This is a recent story that was published from Wuhan. How by wearing one mask, a person who is infected with the coronavirus, if he wears a mask, he can prevent the infection from being spread to other patients. Now, these are 2 very important papers, and I'm not going to go into the details, but I'm just going to tell you the bottom line story. If you wear a mask in the community, and if 50% of the people wear a mask, 50%, and they wear a good quality mask all the time, you can reduce the burden of COVID-19 by 50%. That is the impact of wearing a mask. If 80% of the people wear a mask, 80%, and they wear it properly, then the COVID-19 disease infection rates can go down to almost 0. This is a mathematical report that was published a few days ago that clearly indicates that where a simple thing like wearing a mask has the potential to have a huge impact on the risk of transmitting the infection during this pandemic. This is a very interesting part of so just a few slides more. And this is, the report by the Principal Scientific Advisor to the Prime Minister of India. No surgical masks easily available, no N95 masks easily available. So where do you find the masks then? where nobody who was selling masks. So the Office of the Principal Scientific Advisor to the Prime Minister of India, he made a recommendation on the 30th of March through a very big media coverage that everybody at home can make their own masks. And there's a lot of information that was given as to how to prepare a mask at home, how to clean it, how to use it, and so on. And I believe that this is a very, very important step taken by the government to ensure that all the people in the community are wearing masks. Now, what is interesting is which material should you use to make a mask? Should you use cotton? Should you use silk? Should you use chiffon? Should you use khadi material? What material should you make a mask? Because at that material we used to, because at that point of time there was not the knowledge available as to which is the variety of material of the cloth that offers the maximum protection. They kept it open-ended. This is a paper that was published about a week. I believe this is a very, very important publication. All the journalists, if you can get access to the original paper, I think you must make a little bit of noise about it. So what it compared the efficacy of a cotton mask versus a silk mask versus a chiffon, flannel, synthetic mask, and then a combination of different material. And they looked at two things. What is the filtering capacity of each of those for particles which are less than 300 nanometers, particles which are more than 300 nanometers. Why less than 300 nanometers? Because the size of this is less than 300 nanometers. So is this material capable of protecting yourself from catching the coronavirus infection inside your lungs? Less than 300 nanometers. More than 300 nanometers is the routine air pollution, PM 2.5, that we are exposed to. A very good research study over here. And to cut the long story short, let me only show you the table of the results. So here is the efficacy of the different masks for particles which are less than 300 nanometers. And this is for more than 300 nanometers. You can see that the N95 mask, it says no gap. No gap means it's very tightly worn. There is no gap anywhere over here. Then the filtering efficacy, particles less than 300 nanometers is 85%. For more than 300 nanometers is 99.9%. If you wear the N95 mask loosely, gap from this side and that side, then see how the filtering efficiency, some gap of the mask reduces from 85% to 34% for less than 300 nanometers and from 9 nanometers. That is the importance of wearing the mask for more than 300 nanometers. So just wearing an N95 mask doesn't mean that you will get protection. You have to wear the N95 mask properly. Mask, wear it for 76% efficiency, and for more than 300 nanometers, 9% efficiency. Not very different from the N95 mask. And I think that's an important message. So from a virus protection point of view, N95 and the surgical mask are more or less equally effective. That's a good message that came out from this. If you do not wear the surgical mask properly, the efficiency reduces to around 50%. Okay. Now this is the standard masks that are available in the market. What about the masks that they experimented on? And I have to move this cursor over here because so here it is. If you make a mask made of cotton quilt, okay, cotton quilt, the efficiency of filtering particles less than 300 nanometers is 96%. Now, isn't that amazing? The cotton quilt is more effective in filtering of the viruses than the N95 mask or the surgical mask. If you make a cotton, plain cotton, and this is 80 threads per inch. What does 80 threads per inch mean? That means it's a very loosely woven cotton fabric. There are only 80 threads in 1 inch of that space. If you use that variety to make a mask, that variety of mask, look at the efficiency of filtration, efficiency of protection, only 9%. So the cotton layered mask offers no protection if it is made up of fabric that is 80 threads per inch, one layer. Even if you double the, but it is nowhere good enough to be worn in the community. On the other hand, if you take a cotton with 600 threads per inch, so this is a little finer material of it. One layer offers you 79, two layers offers you 82%. This is as efficient as the surgical mask. Okay, that's carry. If you take a flannel, 57% protection. Of chiffon, one layer is 67%. If you take a material made of layers, is 83%. Natural silk, one layer is 54, two layers. But then see what happens if it's chiffon, two layers, cotton on the inside, chiffon on the outside. Look at the protection that it offers, 97%. Cotton plus flannel, 95%. Cotton plus silk, 94%. Cotton, 1%. And if you do not wear it properly, obviously the efficiency goes down. So what has it taught us? I think it has given us a very important lesson. That simple material that can be made in your home, but of specific material, then it can offer as much protection. It can, if not quality protection, mask or even this surgical mask. And they were surprised when they found that the two different materials that were used, cotton and chiffon, cotton and flannel, why is it giving you efficiency of more than 95%? They think that it's because of the electrical charge that the variety of fabric actually produces. The N also works on that principle. The N95, the middle layer, is charged with a certain amount of electrical charge that prevents the small size particles from going inside, whereas the cotton and the silk and the cotton and the flannel, the chiffon, they naturally have electrical charge inside, which is going to prevent the particles from passing through. So I think this is perhaps the most important slide that I wanted to share with you. We will have to live with the mask for a very long period of time. This COVID pandemic is going to remain for a long time, and we therefore better start getting used to it. The fashion industry has already started making their mark by developing different types of masks, and tomorrow you'll be wearing a mask of the Indian flag. So I can imagine myself going to a cricket match. Everybody in the stadium is wearing a mask. The Indians are wearing the tricolored ones, and the Pakistanis are wearing the green-colored masks. So it's going to be great fun. Culture will now need to be adopted in the future, because wearing a mask is going to be a necessity for our daily routine life as well. And this is the last slide that I wanted to share with you. So this is a lady wearing a cotton quilt mask. She did not know that a cotton quilt can be as efficacious, or perhaps even better efficacious than an N95 mask. You can also wash it every day, and it's cheaper to buy and so on. And the lady on the right is wearing a cotton and a chiffon mask, which she made it at home. So I think that's the future of masks, where simple home masks can be as effective. And this is just to show you the threads per inch. This is sutari. You can see that the number of threads, 20 threads in this direction, 20 threads in this direction. So there are 40 threads per inch. Now, if you make a mask of this 40 threads per inch, it is not going to offer you any protection. So if you want to use a cotton mask, a simple cotton layered mask, it has to have at least 600 threads per inch. Then only it will offer you some filtration efficacy. Now I'm going to stop over here, because these are some of the messages that I wanted to convey about masks, which I thought were important. And I'm ready to answer any questions that you may have.
So, are there any consequences of wearing a mask for a long time?
Very good question. So I showed you the nurse from Wuhan. After she had worn the N95 mask, the skin was tight, everything was tight. You know, N95 masks are not easy to breathe through. And therefore, if a person is suffering with asthma, a person is suffering with a heart disease, they may particularly find wearing a tight-fitting mask, very claustrophobic. It can cause a choking sensation. And therefore, you have to be a little careful when you wear a very tight-fitting mask. The mask has to be able to make you breathe as well, easily. You can wear a plastic mask as well. And a plastic mask will give you 100% protection. But then you can't breathe through it. So that's not a good device. So there has to be a balance between the filtration efficacy and the ease of use of breathing. And many times it can be a challenge. So there are consequences of wearing tight-fitting masks. Some people can get a choking sensation. The oxygen levels can come down. And the media has been covering a few news reports about the adverse effects of wearing a mask. But I think that's a little overstated. It's a little overemphasized. By and large, that happens in a very, very, very minor population. Most of the people would not have any issues if they wear some of these. If they wear a cloth mask for that. It should not have any side effects.
Okay, doctor, thank you so much for answering that. Another question is, a lot of people use masks without washing it regularly. So how often should a mask be washed, and what is, should it be, worn and then discarded every hour, or what is the frequency?
So I'm sorry I did not say this in my presentation. A surgical mask that you buy from the shop, you can wear this for between 4 to 6 hours, not more than that. After 4 to 6 hours, you have to remove it from the ear loops and you have to throw it in the bin. You should not touch any other portion of the mask. If you touch it over here, then you have increased your risk of catching the infection. So a mask has to not only be worn properly, but it has to be removed and disposed of also properly. So surgical mask, not more than 4 to 6 hours. If you're going out continuously, you have to have 2 masks, new masks in a day. And you have to keep on buying masks on a daily basis. The N95 mask has to be worn once in a day, for that one day. The second day you cannot use the same mask because it will not offer you any protection. Those are the disadvantages of a surgical mask and an N95 mask. And therefore, the advantage of a cloth mask is at the end of the day, you can clean it. You can clean it with soap and water and just leave it for drying. That is good enough disinfection. The only thing that you must never do, I've seen this, I've seen the journalists do this, on the television channel. They're the ones who are touching it like this. Here. And you're actually increasing the chances of catching infection because of this mask. So nothing should be touched on the outer side or the inner side. The only thing that should be touched is the mask. If you touch over here, all portion of the benefit of wearing a mask because the virus is now on your hands, and you don't like already caught the infection. So you did a good job by protecting your and you already served the whole day by wearing a mask. After home, you did this, and all the benefit is washed away. So be careful. And washing cloth mask is just like the routine way you do it for other clothes as well.
Okay, thank you so much for that, doctor. Now we have more questions, but they pertain to the first half of the presentation. Somebody has asked, Ms. Geeta has asked, I'm so sorry, doctor. We just got a question which is pertaining to the masks, so I'm going to go ahead and ask that. What is the right way to clean a reusable cloth mask? Is it advisable to put disinfectants like Dettol or something along with soap and water while washing it? And is it advisable to rub it, or will the thread count widen while washing?
Very good question. See, if I have a choice between disinfectant, alcohol disinfectant, and soap and water for disinfection, I would always go for the soap and water. Even if it's a simple, washing soap, that is more effective than the disinfection with the alcohol. The reason is the virus is very, very, very vulnerable to soap. The moment the soap goes on the virus surface breaks away, and therefore it kills the virus. So soap is a better killer of the virus than the alcohol disinfectant. And therefore I would always prefer soap and water wherever it is possible. So to clean your cloth mask, simple soap and water is more than enough. You don't need to put any disinfectant. You don't need to put any Dettol. You don't need to put anything. Soak it in soap and water for some time. You can rub it. Just make sure that you don't rub it too hard, so that the cotton fibers will get damaged. Gentle rubbing is enough, and then you squeeze the water out of it and just dry it in the air. So that should be the way to clean your cloth mask.
Okay, thank you so much for that, doctor. So I'll go ahead and ask questions pertaining to the first half of the presentation. Is there an increased chance of lungs getting compromised after contracting COVID-19, especially in patients with a comorbidity like COPD? I guess what she wanted to ask was, once I recover from COPD and recover from COVID-19 and I have COPD, will my lungs get severely damaged? And will I catch more infections?
Good question. I don't think anybody knows for that, because the disease started only in the end of December. So we are only 5 months into the disease. What are the long-term consequences of this infection? So if I'm a healthy person, I have got a COVID-19 infection, I have recovered from it, what will happen to my lungs for the rest of my life? Will it remain healthy, or will there be some residual damage over a period of time? Nobody knows the answer for that, because we need time to find that answer. The same thing is true for patients of COPD as well. So if I'm a patient of COPD, I have got the COVID-19 infection, I have recovered from it. Will that COVID-19 infection give me long-term sequelae, long-term complications? Only time will tell. And I think we'll have to wait for those studies. Without that, I think it will be very difficult to speculate. We know that with the SARS-CoV-1 virus, which was the earlier SARS virus, patients of COPD did find evidence of long-term greater damage in the lung after the SARS infection. Now, whether the same happens with the SARS-CoV-2, then we don't know that answer yet. We'll get to know with time.
Thank you, doctor. We have another question which is very general. Still, I'll go ahead and ask. Chances of COVID-19 people affected by COVID-19 is very less in the future again. Is this right or wrong?
Can you repeat that? Your voice was breaking up, please.
Sorry about that. Is COVID-19, going to be a permanent thing, or chances of COVID-19 affecting people is less in the future again?
How long will the COVID-19 last? Okay. My guess. Okay, so my guess is the COVID-19 is there to remain with us for at least another 1.5 to 2 years. It is not going to go away before that. Life will not be the same as it was before the COVID-19. Life is going to be changing completely from, once the lockdown is lifted, everything is going to change. The way you travel, the way you go to work, the way you go for shopping, the way you go for social functions, everything is going to change. The virus will remain until either we find a vaccine for it, or until you develop herd immunity. Herd immunity is where 70 to 80% of the people are infected by the virus, and they then develop antibodies against it naturally. And because they already have antibodies, the virus now cannot multiply, and then the virus goes away. Now, that is going to take a long time, because to get 70%, 80% of the population infected is too risky. because there will always be 5% of people who will develop severe COVID disease. And these 5% of the people will require ICUs. They will require ventilators. And so the numbers can suddenly swell up in the hospital within no time if you take that route of herd immunity. The only thing that we can actually do as of now is wear a mask. Please wear a mask whenever you go outside. Hand hygiene, social distancing. This is going to reduce the spread, and this is going to increase the duration for the virus to remain in our country. But we have no other choice, because if you want everybody to be infected tomorrow, then everybody will get infected, everybody will develop antibodies, and then the infection will go away. When it will come at a very, very big cost. The healthcare infrastructure that we have is not adequate to deal with that. So imagine that you need 5,000 beds in a city like Mumbai, for example. That is not easy at all. So that is a price that we will have to pay, and therefore for that, developing a vaccine sooner than later is the way to go forward. And then the second, as I said, is mask, hand hygiene, and social distancing. Yeah.
Thank you so much, Doctor. What is the effect of redirection of resources towards COVID-19 when on other chronic respiratory illnesses? Have you, in your recent experience, seen some problems that people with CRDs are facing?
So as I said, we have seen that. So patients with COPD are more likely to have severe COVID-19 infection, and they're the ones who are likely to die. The other chronic respiratory diseases, asthma, we have not seen that so far, for reasons that are unknown to most of us. But I think the government's focus now is only on COVID-19, and rightly so. So everything else is now put on the back burner, whether you have a chronic lung disease, whether you have a heart disease or a kidney disease. They're all waiting in their homes for the pandemic to pass through. And it's important to give priority to this because this has got huge public health implications, and therefore this has to be prioritized as of now. Yeah.
We have a question. With the first SARS virus, if a person did not have COPD, then was there long-term damage to the lungs?
Yes, there were some patients who developed long-term damage to the lungs in the form of pulmonary fibrosis. So it's not COPD, but pulmonary fibrosis, which is as bad as COPD, but the proportion was small. So out of, if I'm not wrong, out of 100 patients who developed the SARS, the original SARS viral infection, about 5 to 10 of them ended up having chronic lung problems. The remaining did not. With the SARS-CoV-2, we do not know the answer yet.
Thank you so much, Doctor. There's a last question that I wanted to ask personally. If I am a patient of COPD or asthma and I have to wear masks at my workplace, so it is very difficult to breathe through masks, what should I do?
Good question. So I think wearing a mask is a necessity. I don't think you can get away from it. Because so at the work, maybe in the office you can potentially remove your mask and wait and do your work. But when you're traveling from your home to your office, you must wear a mask. Unless your office is so big that there are 200 people sitting in the hall, 50 people sitting in the hall, you do not know where the infection will come from, then you have to wear a mask in the office as well. But those are the prices that you will have to pay, because if you don't wear a mask, the chances of you catching the infection are high, and it's not worth catching the infection, especially if you have underlying chronic lung problems.
Okay, thank you so much, Doctor, for taking all our questions. I'll hand over to Dr. Jaya to take it forward.
Thank you so much, Dr. Salvi. I mean, this has been wonderful, and I wanted to say that all our South Indian Carnatic vocal concerts, they have to, performers have to learn from you. You haven't taken a sip of water since you started. Anyway, I just wanted to, after personal thanks, just wanted to hand over to Ms. Anupama Srinivasan, the Assistant Director of REACH, to sort of convey our formal thanks on behalf of REACH and all the journalists who've been benefiting from your talk. Anupama.
Thanks, Dr. Jaya. I think in many ways, this is such a great time to be a health journalist, but also obviously a very challenging time. Every day we're seeing new research, new evidence emerging, things are changing constantly in terms of guidelines. We've seen it's really hard to stay on top of all the new information. And I think that's why we're very grateful to have the guidance of someone like Dr. Salvi to help us make sense of some of this and to look at all these complex issues, COVID-19, COPD, air pollution, asthma, other respiratory diseases. So thank you so much, Dr. Salvi, for taking the time to patiently explain this to us. As Dr. Jaya said, close to 2 hours. I'm sure we'll be back to trouble you in the future as well. And just want to say thank you so much to all journalists who've taken the time for this. We feel that you're more important than ever right now, and you have a great responsibility in making sure that people are reading the right information. Thank you for your great questions. Apologies if we didn't get to answer all of them. And we do hope this webinar has helped throw up some potential areas that you can explore in depth. Please feel free to reach out to us. Eid Mubarak to everybody. Please stay safe. Thank you so much. Have a good day.
Thank you. Thank you.
Thank you. Thank you. Bye-bye.
Bye-bye.
Thanks, everyone. Bye.
Thank you, everyone. Bye.